So we now have Professor Nabi Tayyab, who does not need any introduction, and he is leading the campaign of hepatitis elimination, and is going to talk about the Punjab perspective as far as hepatitis elimination is concerned.
Thank you, Dr. Asad, and thank you, Management, Pakistan Society of Hepatology, for inviting me here to talk on elimination of hepatitis C in Punjab. I and Dr. Homa have been working since inception of elimination program way back in 2015, and we have been sitting together on various boards on the national forum as well as on the other forums. And in the past, I've been project director for building hepatitis clinics in Punjab, similarly GI units, and I developed guidelines for hepatitis B as well as C for Punjab hepatitis control program. So you have seen this slide that way back in 2008 when Dr. Homa did the survey in Punjab, the prevalence was roughly about 5%. And then we did another survey in 2018, EPIC survey, where it showed that it is 8.9%. And another survey which was done just recently, all the results are not out. We are getting the information that probably the figures are a little further up, and now it's 11.1%, meaning by that, though we have been working quite effectively and quite efficiently on hepatitis C control in Punjab, but somehow, since the factors which lead to spread of the disease, they are still there. So the seropositive patients, the serology is being found positive in more and more number of patients. And mind you that there are two things. One is viremia, the other one is serology positive. So these are two different things. Way back in 2017, when we are devising the program of hepatitis C elimination in the country and in Punjab, we went off with three-pronged strategy. One was to deal with the ultimate patients who are in the liver failure, and for them, Punjab Kidney Liver Institute was created. And the other aspects, in order to develop the human resource, in order to bring more human resource into the system, we developed a system to train more number of people in the teaching hospitals, and for that, in the special healthcare, we developed more number of gastroenterology units, and in the primary and secondary side, where the cover is there in the district and Tehsil headquarters hospital, and similarly lower down, we develop hepatitis clinics over there. This is the model that we had developed for the specialist healthcare, where gastroenterology unit, endoscopy suite, and similarly hepatitis clinic, one each for one special healthcare facility or teaching unit was created. And then the purpose was to supply human resource, train human resource, deal with the complicated patients, coordinate with the hepatitis clinics and district and Tehsil headquarters hospitals nearby. And that was the concept. And similarly, to give support to the Punjab Kidney and Liver Institute, so that not every patient should go straight to Punjab Kidney Liver Institute for assessment and evaluation. Similarly, downwards, once they have done the transplantation, the enough human resource should be available in the different areas where they should be able to manage the transplanted patients. Similarly, the ones who need a high-end care and back to their respective areas, so that they may be able to take they may be able to be taken care. Now, in terms of the Tehsil and district headquarters of primary and secondary, this is the network of hepatitis clinics, and starting from somewhere 130 clinics now. In 2022, we have 281 clinics in the whole province. So a good network of hepatitis clinics, and they are there in the Tehsil headquarters, they are there in the district headquarters hospitals, they are in the sister headquarters hospitals, they are in the sister hospitals, and similarly, they are there in the hospitals which are there in the jails and other specialized places. And we are coordinating with the various universities as well for the same purpose. So in total, we have 281, and in this, we have partnership with the private hospitals and private setups as well. This is a new thing. You just heard private-public partnership, and in the same line to develop this private-public partnership, we are already working on that to develop. These are the timelines that we worked on starting from 2005 and up to 2022, where we we have developed various components to deal with hepatitis. If you look at this cartoon, this is the dashboard figures of 28th of July 2022, the day when hepatitis day was celebrated, and you can see that there are healthy numbers in terms of registration in the hepatitis clinics, and similarly vaccination figures are pretty good, and then enrollment for hepatitis C, they are catching up, and unfortunately because of flood, you can see that this is the picture from today's dashboard, 23rd of September 2022. Numbers have gone up, but they are not all that healthy, and the impact you can see if you compare on the two cartoons that the definitely impact is there. And this is the overall performance status of hepatitis clinics in Punjab. You can see that screenings have been done, PCRs have been done, treatments have been provided. SVR data is available, but to a limited extent, not to that extent. And starting from right to the left, you can see that the progress is there. Now, what were the best years? I think 2019 and later of 2018, 2019, and early of 2020 were the best months of our control program. But then because of the COVID, the disruption came, and now the flood is hitting. And if you look at this flood situation in the month starting from July and up to September 12, you can see that the numbers have gone down. In July 25, you can see when we had done the mass campaign for hepatitis, the numbers went up for the registration, but very soon, because of floods, they started to come down. Whereas flood hit areas like Miawali, you can see that there's an impact of flood. Similarly, at Laya, the numbers went further down. Muzaffargarh, another area which was severely flooded, again the numbers went down significantly. Rajanpur, right next to Indus River, again the numbers went down significantly, so much so that in whole week we were able to register just 34 patients. And the challenges remain there, that we need to find the missing millions in the community. There are three sets of the society. Ones who are well educated, who are affluent, they get themselves treated every now and then. Even if they are positive, they keep getting themselves tested again and again. Like Raymond said, test and retest. So they are the ones who get tested multiple times, and then just to have the reassurance that they're negative, so they keep doing it. Then there's an intermediate strata who come to the hepatitis clinics and get themselves tested, and wherever we hold the camps, again they come there to get themselves tested. So again, one kind of reassurance mechanism. But majority who live in the community, those who knew the disease, majority got themselves treated. Lots of them, and lot more of them, they're there in the community who have the disease, but unfortunately they don't know about their status, and those are the ones we need to target, and we need to link them to the care. Number of times I've discussed that in each and every hospital we deal so many deliveries, we deal with so many childbirths, and we deal with so many surgeries. As per statistics, we should have a significant number of HCV positive. Do they get reflected in the hepatitis clinics attached to those hospitals? The answer is no. So we need to bring something in this connection to link those patients who get tested positive to the treatment center, and then effective implementation of cascade of care, which is there. And let me tell you, at least in Punjab, the cascade of care, the clinic network system is quite effective, quite robust, and we need to document the SVR and follow up beyond to pick those patients who are suffering from cirrhosis and the complications of cirrhosis that they occur, even if the HCV is negative in terms of decompensation or hepatocellular carcinoma. If we talk about the finding the missing millions, we need to have a good infrastructure which is there. Strategies need to be developed. We have been talking about micro elimination. We have been talking about macro elimination. The action plan needs to be set. The target in Punjab at least is 375,000 patients per annum. Macro elimination, we are already onto it. Micro elimination, personally, I'm not a great believer of micro elimination, just for one reason, that I think that in Pakistan, this is a very, very expensive approach. We cannot afford for this approach. Netflix approach, wonderful. We need to come up with these kind of innovative ideas to bring the people into pool. Our main challenge is finding the people in the community, bring them into the loop of care, and once they are in the care, either through the partnerships with the other hospitals, with the sister hospitals, with the family physicians, with the local hospitals, with the local peers, and similarly people of influence, we need to go further for low cost steps. These medium cost and high cost steps, probably we don't have the funds. Dr. Homa and I, we have been struggling for um, generating the funds, convincing the government to pass a PC1, and the PC1 for the national control of hepatitis C is lying pending for the past 2 years. And just last week we have been talking to them on the same account, but it is not there. So high cost steps probably, and similarly medium cost steps are beyond our reach. We need to look at the low cost steps, low hanging fruits, to bring the people into a pool. And this is something we need to effect. Effective implementation of whatever is available, that is a key thing. The system is robust. We just have to use we just have to learn from the lessons that we got from the COVID control in Pakistan. As compared to other countries, we were able to control COVID in a much better way. The dissemination of information was much better. So on same account, we need to have a good, effective messaging to the people in the hepatitis side as well. And we need to implement this Punjab Hepatitis Act, which was passed in 2018, in its more effective fashion. The tools are there. Implementation needs to be ensured. Target is end hepatitis C by 2030, and that's what we need to achieve, and that's what we need to work for. Will we be able to achieve it? There are lots of skepticism, but I think if we work hard, we still have 7 years ahead with us, and we should be able to achieve it. And with this, an important message that in February 2023 we have an annual meeting of Pakistan Society of Gastroenterology in the same hall, in the same hotel. You all requested to please participate and come in big numbers. Thank you very much.
Thank you. Thank you very much. This will bring us to the end of this talks, as we had one from WHO Control Office. Unfortunately, Dr. Pasha was to come, couldn't make it today.